I'm Hala Nassar from the National News in Abu Dhabi, and today in the 1 Billion Followers Summit, I'm interviewing Dr. Mike Warshawski, who is a family doctor with a social media presence. Hi, doctor. How are you today?
Very excited to be here in Dubai. It's my first time. I'm seeing a lot, learning a lot. Very exciting.
Great. So my first question is, tell me how you became the go-to doctor on social media.
I think I was lucky in that I was early in the time frame when social media was starting to accept experts on it to talk about their experiences, their knowledge. And what I found is that leaning into trust and not being afraid to say, I don't know, resonated very well. Because we live in the era of certainty and false promises and overconfidence. And on my channel, what we always talked about is, I don't know everything. But here's what I do know, here's where we're learning, here's how we can get better. And I think when you lead with that level of humility plus transparency, I think you get a really good result. I think with 1.2 billion views just in the last year, I think the results speak for themselves.
Good on you. I mean, I've been watching your content for the past couple years, and I've been very interested when people go online and ask you questions. But why do you think that people go to social media for health advice?
I think it's because of the quickness of getting an answer. Everyone's first reaction when they get some sort of health information or health news is to pull out their phone and search an answer. The problem with that is you don't always get quality sources, especially on social media. There are some social media companies that have been doing better than others. YouTube does a step above by verifying who's an actual medical professional versus someone who's just putting on a white coat and pretending to be one. But I think what has earned the credibility is the fact that we've leaned into the honesty of the field. Instead of telling people what they need to do, I tell them what I know, what I would do for myself and my family, and that has really worked well in creating and distilling a complex scientific message to the general public.
Well, that's very wise. But speaking of trusted sources, I mean, what do you make of all these conspiracy theorists who peddle mistruths about medicine, talk about them, become viral?
I actually understand why they do it. It's very easy to go viral when you go against the constitutional norm. Think about how much content there is about doctors saying, eat healthy, sleep well, exercise often, focus on your mental health. Everyone's saying the same thing. So if you can come in and make a big promise, eat this food that I created and it'll help you live longer, that's engaging. That confidence is very palatable. You want more of that. And the social media companies know it, so they like to push that sort of narrative. However, when I see content like that, I don't judge those people. What I like to do is introduce a level of skepticism, healthy skepticism. So if you were to tell me right now, I'm the fastest 100-meter runner in the world, I would say that's great. I wouldn't necessarily believe you right away, but not because I don't trust you as a person, because I don't know that you're that fast. There's been no Olympic verified watch that has timed you. But if you provide that data, I'll absolutely believe you. But the reality is a lot of these conspiracy people don't have the data, they don't have the knowledge, and as a result, they're just peddling their feelings as facts, and that's not good.
Yeah, I mean, a lot of people do publish about medical things that you're a bit unsure of the source, but what do you think about the rising trend of medical influencers? Do you think people will lose their trust in doctors? Is it harmful? How so?
See, I think the worry of why doctors didn't immediately go to social media is because they were worried about being labeled unprofessional. They thought that they would somehow lose their credibility, their prestige of their knowledge. But that's the furthest from the truth. If you truly want to create a good doctor-patient alliance, you have to relate to someone. You have to show them that you're human too. That when you go in and you get an AI answer, even if it's from a human, it doesn't feel good. But if you get a human talking to you who has children, who has a dog, who plays sports, who has suffered loss, that information carries a lot more weight. And in reality, the people who are conspiracy theorists do this best. So I've actually studied and learned from the conspiracy theorists how to do better in communicating and making people understand the message.
I agree, a dog would make things better. But I mean, considering that you've given health advice to a lot of people, what feedback have you gotten from those people who you've given health advice to and they listen to you?
There's nothing more rewarding than seeing an email come across your inbox that said, you helped me save my loved one's life. A big thing that we talk about on the channel, it's a catchphrase of the channel, is chest compressions, chest compressions, chest compressions. Hands-only CPR. That if you find someone down who doesn't have a pulse, after calling for help, of course, you have to start chest compressions. So often when we watch the medical dramas, the Grey's Anatomies of the world, they'll run with the defibrillator. That's not what we do. We have to start chest compressions. And by teaching that on a big stage like social media, we've been able to save countless lives because of a simple act like that. And there's actually even a higher value to social media. You could also advocate in your government, the changes in your community. For example, I was blessed to save someone's life on a plane when there was no medicine on that plane called epinephrine in order to open their throat when they were having an allergic reaction. And after I told that story on YouTube, I worked with policymakers in the United States to change the law so that planes had to carry that medicine so that future lives can be saved. Without social media, that would have never happened.
I feel like that's the dream of every doctor, like save somebody on a plane.
It's straight out of a TV show, but it's exactly what happened. We're able to save this young gentleman's life and create also a learning opportunity that has changed the future as well.
I really want to ask, do you think the future of medicine would be online now that there's, a lot of doctors finally going to social media and posting about medicine? Is this the future of medicine?
A digital-only world is not compatible with human life. Not compatible. Because we need human touch, we need human connection. As much as you can create similar situations through virtual and augmented reality, it's not the same. Our minds can tell the difference. It's why bullying online is very different than bullying in real life. If you hurt someone's feelings in real life and you watch them get sad, you watch them cry, it's very different than the effect that you have when you say something mean online and you get a lot of likes. So we always have to balance digital plus real life. Even when it comes to AI, it's a tool, but we always need humans to work with the tool and not just let AI be the answer for everything.
I appreciate that you said that because now we're transitioning into a world of AI, I guess my final question to you is, what advice would you give people who look to social media for health advice? What to look out for?
I think doctors traditionally have been very judgmental of patients who come in and saying, I Googled this, I searched this on YouTube. I don't. I actually find that very beneficial because that is a patient who is engaged, who wants to know, who's looking to learn about their health. The most difficult patient is one who doesn't care, who doesn't want to know what medications they're taking, who doesn't want explanations because they're less likely to take the advice and understand the advice. But if you have a patient who's Googling, who's learning, I use that as an opportunity for them to get better questions so that when they come into my office and I ask them the most important question that I ask any patient and every patient is, have I answered exactly what you came in for? Or what do you think is going on? And a lot of times they'll reference something they read online, and that's a great chance for me to educate, not just give them the exact answer that I think is right, but answer the reason as to why they came in and why they were initially concerned.
Thank you for being so thorough with my questions.
Of course, thank you.
Yeah, it was a pleasure having you on The National.
Absolutely.
All right, thank you so much for joining us today. Anything else you'd like to add?
As always, stay happy and healthy.
Thank you.